Okay. I also actually see a patch of flakiness here, and I would agree this does resemble psoriasis, just based on the pattern of the flakes. These are two separate tattoos, yes?
Yes.
Okay. Right. So just making sure, because I do see two different healing stages here, so just making sure. Okay, so we've got quite a large mole here. I do see one slightly more elevated above the skin here than the others. So it looks like some of these angiomas that you have are rather flat, and then some of them are quite protruding. So this one does resemble the one on your left arm. Just lifting your top up enough to see the scar tissue here. So I'm going to do just a visual inspection to start with. Do you have any pain or tenderness there? Any nerve damage?
Nerve damage, definitely.
Can you feel that here?
Yes.
Here?
Much lighter, but yes.
Much lighter, but you can feel it.
Mm-hmm.
All right. Something much more significant can you feel here? This is pretty sharp.
Yes.
You feel sharp here?
Yes.
Do you feel sharp here?
No.
But do you feel anything?
No.
You don't feel anything there.
Oh, that. There. Right there, I felt that.
You feel it here?
That one. It's like very specific points of it that still have some nerve.
Okay.
So
if we do vertical instead, do you feel here?
Very, very lightly. I have to pay attention.
Okay. Stretching of the skin allows me to see if there's anything concerning there, but it's not notable. Okay. All right. Hello, Miss Ariel.
Hello.
How are you feeling?
I'm feeling good, thank you.
Good. Thank you so much for coming into the clinic. I have you in as a new patient today. I do apologize for having to meet you in this position. I had my medical assistant go ahead and get you ready as I was running a little bit late for your appointment, so thank you for your patience.
Of course.
Now, going over your notes, it looks like I have you in as kind of a follow-up. You are new to the area?
Yes.
Okay, well, welcome. Welcome to the area and welcome to the clinic. We're happy to have you at the Siesta Clinic today. My name is Dr. Perez, as I stated, and I am the house dermatologist, so I will be having a look over and addressing any of your concerns today. Now, I did see that you have sent over your documentation from your previous dermatologist, and it looks like you did have quite a significant melanoma removed from your back.
Yes.
Okay. So are we just following up today? Did you have any specific concerns? Are you noticing any, secondary abnormalities to that, or is this just a general wellness exam?
I have some, moles that I want to get looked at and just kind of a once over to see if I have any new concerning growths. And then I have some strawberries, that's what I call them.
Okay.
And they're kind of taking over. I'm starting to get them on my face, so I just want to.
Okay, so I do see one here.
Out.
That's what you're speaking of. These little, they look like angiomas to me so far. I see one here on your temple as well. Okay. Are those new entirely or just new on your face?
They're new on my face. I've been growing them my whole life.
Okay.
Pretty much since I started getting freckles. They started showing up as speckles and then eventually turned into like the one on my arm.
Okay, and I do see quite a few here as well as you've got a couple on your chest. Have you ever had any of those biopsied?
No, I haven't.
No, okay. And when you were seeing your previous dermatologist, did they express any concern there?
No, at that time they weren't.
Not as prominent? Okay. Have you had any children by then? By chance?
Yeah.
Okay, you've had children since then. So I do notice sometimes a correlation between the two for whatever reason, whether it be like an increase in hormone production, that kind of thing. I do sometimes see in women that there is a change in, mole shape and size, or just kind of the amount that you had before versus after pregnancy. So that could be something there, but I will have a look at them for sure to see. This one especially looks a little bit raised, and then the ones on your chest here as well. No pain or discomfort there, right? No tenderness or itchiness or anything? Okay. All right. So just asking you a couple questions about, your overall health. Any issues with your hair, your scalp, the hair itself, or like the skin of the scalp, any dandruff, psoriasis, flaking?
Yeah, I have what I think is psoriasis.
Okay.
I get
gonna
medicated
have a
shampoo by my PCM, but it doesn't really alleviate the issue. It kind of just helps with like the overall flaking.
Okay.
So and then my hair, I mean, I think due to my poor scalp health, my hair is very, brittle and it doesn't grow. So,
Okay. So I do see a couple of those angiomas on your scalp as well. You've actually got two just here. And I do notice just a little bit of flaking. So from what I can see, it doesn't look, excessive at this time. But you could just be not in a flared up state. So I will have a bit of a more in-depth look at your scalp, see if I see anything there. Now, as far as the brittleness of your hair, I also see that you've got color treated here. Is this bleach treated as well?
it's the charcoal.
Okay. So not
lightener.
quite as harsh. All right. And do you ever notice any like anaphylactic or allergic reaction to hair dye or any products that you're using?
The only thing that I have an issue with is bleach. Because of the issue that I have with my scalp, I cannot get bleach on my scalp.
Okay, all right, I see. So just going into the pen light, doing a brief kind of overview here, see if I'm seeing anything more concerning. I don't see any, redness or anything. No signs of erythema, or I do see the flaking that you're talking about though. I do also see a couple of those angiomas here, so I just want to have a look in. We've got two here. Any history of skin cancer in your family?
Yes.
Okay, and is that paternal, maternal? You also have quite a large one there.
It's on my mother's side.
Okay.
Yes.
All right, and semi-unrelated, I was reading up on your notes and it did look like you had some sort of abnormality in the healing of that melanoma. Can you tell me a little bit about it? It looked like some scar tissue was formed or something.
Yeah, so because of the placement of, it was a birthmark and it was in the middle of my back. So due to the placement and, having to go to work and things like that and having to give it air, it would rub against my clothing, especially bras, even if I wore gentle fabric. And two of the stitches ended up busting open.
Oh, I see. So kind of friction induced. Okay. And did that end up healing okay? Was it prone to infection or?
Yeah, I ended up getting a small infection. But overall it healed fine. It just, because of the stitches popping open, there's like clear scarring.
Mm-hmm. Okay, so more so than just the incisions that were placed.
Yeah.
Okay. So I do see another one of those kind of spots of demarcation here. They're so hard to spot in the scalp because you gotta hunt for them, but I do see one here. Okay. I also actually see a patch of flakiness here, and I would agree this does resemble psoriasis, just based on the pattern of the flakes. Is that shampoo that you were prescribed like a ketoconazole kind of?
Yes, yeah. It's the pink one.
Yeah. Have you ever considered something like a scalp injection?
Yes.
Is that something that was discussed with you?
Yeah, I think that would be good because I've tried topical, everything that they've thrown at me and it just isn't working.
Okay. So that's definitely something we can look into. I'm going to continue with your scalp exam. I might want to have you in for a more dedicated scalp inspection where I can do, have more time, do a more in-depth inspection and have a look and see really if there's anything that I think is concerning or worst case scenario is that something needs to be removed, obviously, removed for biopsy, for testing, or removed because it, is cancerous. So in order to do that, it would, it's about an hour and a half exam. I've got to section your hair and, have a really in-depth look. It's more lengthy than what I can perform today. I would like to do that prior to starting with the injections, if that's okay with you, just so we can get like a better overview. And then I can decide. There are a couple different medications that we would be looking at. Most of them are effective for about 90 days. Now, you do notice kind of the symptoms do start to return kind of slowly as the dosage wears down. So about 2.5 months in, you'll start noticing some of that flaking coming back. And then obviously by the 90-day mark, we'd like to see you back in. So just something to keep in mind.
Okay.
And how frequently are you washing with shampoo, with the ketoconazole?
Maybe once or twice a week.
Okay.
I try not to overdo it.
And how often do you wash your hair? Is that
like every other day?
okay? All right. I mean, as long as you find that that's the best, time frame for you, if you've kind of played around with it and every day, it definitely is not recommended because it can be over drying. Every other day is still semi-frequent, but if you find that, you're going longer than every other day, that the flaking is just too noticeable, then that's, certainly understandable as well.
Yeah, I noticed that if I don't wash my hair that frequent, the flaking is very prominent,
Okay.
but also it's painful.
So have you turn your head this way for me for just a second. It's painful as well. Okay. Just having a closer look here. Okay, so the flaking seems to be more prominent actually on the sides versus on the crown. Just looking for any. Okay. Any itchiness with that?
Oh, definitely. Yes.
Okay. Now if you turn the other way for me. Okay. So essentially what I'm doing is just having a look at the flaking, trying to, gauge if I think this is something more fungal, because you can get, yeast of the scalp that can cause that itchiness, but this definitely looks more of a scalp psoriasis to me. Okay. All right. Let's see. Okay. So I'm going to do a little bit of percussion here. I just have a very small reflex hammer. If I tap along here at the hairline, is any of that tender?
No.
Good. And no tenderness at the cranium, nothing sore?
No.
Good. Okay. So I'm just going to feel around here. I'm going to kind of gently palpate the back, feel for any abnormalities there. No swelling or anything. That's good. Okay. I'm going to do just a very light tugging at the hair, checking for strength and integrity of the follicle. So if I'm tugging gently and, hair is shedding, then that is obviously abnormal, but not noticing too much of that here. Okay. And did you happen to have any issues with postpartum hair loss?
Oh, yeah, but it wasn't like big chunks. It was just thinning.
Just more shedding than normal? Yeah. And do you feel like that's dissipated, not something you're kind of dealing with anymore, or?
I think that I'm not dealing with the thinness so much as it's just not growing.
Okay, so I do see just a little bit of breakage. How frequently are you getting trims?
Oh, I haven't. I mean, with my kiddos, it's just hard to get to the salon.
Okay. So something you want to consider is that a lot of times we think, my hair's been the same length for a while, it's not growing. But when we think about hair growth versus retention rate, sometimes what I tend to find specifically with my female clients or my female patients, who, get their hair dyed occasionally or are not getting trims, more than, 2 to 3 times a year is kind of minimum recommendation on my end. We start to see breakage from the end of the shaft upwards. and that really closes in on that retention rate. So it could very well be that your hair is growing, it's just not maintaining its length on the other side. Does that make sense?
Yeah, like just breaking
Yeah,
off.
so it's growing from the root, but the length is breaking off at the oldest part of your hair, which is obviously the ends. So just something to consider, especially if you're heat styling your hair, semi-frequently. So I would consider using, a decent heat protectant, definitely to protect your hair from, any thermal products that you're using, whether it's a, blow dryer, curling iron, whatever the case is. A good way to track that, especially for you since you have color, is that you can actually measure the length of your hair currently, where your natural hair is to where your color starts, and then 2, 3, 4 months from now measure again and see if you've got any change here, and that'll really give you an idea of whether your hair truly is not growing or if you're just not maintaining the length at the other side. Okay. All right. I'm not seeing any structural issues, no loose strands as I'm kind of manipulating your hair, no excess gumminess or anything at the ends of your hair even. They do feel, fairly strong. Your hair is well moisturized, so I would say, for the state that it's in, it does look healthy on my end. If you have any, really specific concerns or you're wanting any like supplement recommendations, that is something that I can give you as well.
Okay, great.
Okay, all right. All right, Miss Ariel, so I'm going to move down and start having a look kind of at your skin as a whole. So I'm going to start with the upper body and we'll kind of work our way down, okay?
Okay.
All right, so coming in and looking at some of the concerns we were talking about. So I do see one here specifically that is raised pretty significantly above the surface of the skin. And though it does appear the borders are fairly symmetrical, I don't see very many ridges. I would say slightly asymmetrical here at the northern border. And we're definitely elevated above the surface of the skin. Color is very consistent though, which is good. So typically with the angiomas, it's essentially a blood vessel that's kind of raised above the surface of the skin and become, stuck. These can be quite cumbersome. They're not typically painful or bothersome really unless you nick it on accident, and then it tends to bleed. So most of my patients tend to learn that the hard way.
Yeah.
So for the most part, we recommend kind of leaving them alone. Really, the only thing to mitigate this here is just to have them lasered. So you can have them lasered off because you have so many. Obviously, the treatment would be quite extensive, but it's also likely that they would just grow back, or that you would grow some in other areas. So while you can have them removed, there's nothing to prevent new ones from replacing them on other areas of your body. So that's really a personal choice for you. I tend to think they bring a little character, but everyone is different. So that's certainly up to your personal preference. I wouldn't say, however, that they're anything I'm deeming as concerning at this point. Okay, so far these look okay to me. So as with your melanoma that you had on your back, you always want to look out for things like, asymmetry in shape, abnormal ridging, any changes. That's a big one. So if you have ones that you've had for a very long time and they start to look different, then that is certainly concerning. Inconsistency in color, darker colors like black or dark brown tend to be more suspicious versus something more flesh toned. So things like that, just kind of look out for. Now I will say, because you have them everywhere and not just in places that are visible to you, like I did see quite a few on your scalp, I do recommend that you come in at least annually so that we can have a look. Excuse me. Don't see any on your hands. Your tattoos are very well done.
Thank you.
I feel just a little bit of warmth here, but you did have your arms crossed. All right. So I can tell that some are more recent than others, but they all do appear as if they've healed quite nicely. I'm not feeling any scar tissue, at least not here on the left side. Oh, you've got some on your fingers as well. I completely missed those. Okay. These ones feel okay. Do you see a small scar here on your hand? Is that, I see two actually.
Yeah, one was from a dog scratch,
Okay.
surprisingly. She just jumped up and got me. And the other one was from high school. I honestly
Oh,
don't even
okay.
remember where it came from.
Interesting. They're both fairly shallow, but you can definitely see them. All right. Okay. Now I do see one mole here on your elbow. This one might be a little hard for you to keep track of because it's kind of out of your regular range. You might be able to see it in a mirror. It has a very small black dot in it, so just something to keep track of there. If you notice that that darker color is kind of taking over, then that might be something that we need to look at because the rest of it is quite a bit lighter than that one little dot in the center there, okay? So I'm just going to take a little mental note of that. The left outer elbow, got about a 2 centimeter mole there. The rest of these all look okay. All right. Okay, so I'm going to adjust a little bit and come down and have a look at the other side, okay? All right, Miss Ariel, so I'm just coming in to have a quick look at these ones on this side. So looking at your tattoos as well as any of the angiomas that I see here. So you've got a freckle there. Fairly large. These are 2 separate tattoos, yes?
Yes.
Okay. Right. So just looking, making sure, because I do see 2 different healing stages here, so just making sure. Okay, so we've got quite a large mole here. It does appear normal to me, though. Don't see any signs of discoloration there. It is larger than your other ones, though, so for that reason, I'm going to have a closer look at it here. So just have you hold your arm up for me here. I'm just going to have a closer look at this one. Okay, so yeah, we're okay there. Okay, you can go ahead and relax. Doesn't look like anything super concerning to me. Do you have any areas of your belly that you've been concerned about?
I just have the strawberries on my stomach.
Okay. I'll just take a quick peek then and see if there's anything I think we need to look at. Okay, so I see 2 there.
There's some up here.
Oh, okay, so I do see some larger ones here. Let me just see. Okay, so same. So you've got quite a few.
Mm-hmm.
Okay. All right. I'm just going to move your shorts up here slightly.
Funny story about the one on my left. The artist used those strawberries as part of the tattoo.
Really?
Mm-hmm. So you'll see some of them, and you can't really tell what is what unless you touch it.
I see. Oh, I see. Okay.
Mm-hmm.
That's actually really interesting. Very cool. Very nice way to work them in since they are a part of your body. It's always good to embrace things, especially if we can't change it and it makes us unique. So it's very nice. And I don't notice any abnormalities in the healing of your tattoos. They all look very smooth and even. Just feeling around. Sometimes scar tissue can form underneath, so just feeling for any ridging there, but I don't feel anything. Okay. This one looks fairly new, but it does appear to have healed well. All right, just gonna have a look at the inside of your leg. going to go ahead and come around on the other side. All right, Ariel, so having a look at this side, I do see one slightly more elevated above the skin here than the others. So it looks like some of these angiomas that you have are rather flat, and then some of them are quite protruding. So this one does resemble the one on your left arm. And I see what you mean here by he kind of mimicked some of these in the tattoo. You did a very good job at color matching. You really can't tell unless you feel them. Okay. You got another, sorry, you have another mole here at the ankle. Now, with the angiomas, it's a little harder because you have so many, but with the moles, do you notice or are you able to keep track of them?
I generally try to. I try to like give myself a once over every once in a while to see if I have anything new going on. But usually it's just a freckle here, a freckle there.
Okay, and then I'd imagine because you have so many, it is just kind of difficult to really keep track
I'm
of
covered
everything.
in freckles. It's really hard.
Okay, all right. All right, well, everything on the front portion looks seemingly okay. Now, I would like to have a look at your back. I really want to have a look at that removed melanoma and see, have a look at the scar tissue, and then obviously see if there's anything back there, mainly because you're obviously going to have a harder time looking at your back than your front. So I'm going to have you turn over on the table for me, and we will go ahead and get started with the posterior exam.
Okay.
All right, Ariel, so coming in and having a look at your back, I'm going to go ahead and look at the areas that you were talking about here. So again, consistency with what we're seeing on the front end. You do have quite a few abnormalities on your back as well. I'm just going to lift up. I'm assuming okay, I see. So just lifting your top up enough to see the scar tissue here. So I'm going to do just a visual inspection to start with. Do you have any pain or tenderness there? Any nerve damage?
Nerve damage, definitely. It's like a sensation, the pressure, just no feeling.
Oh, okay. So you're having some loss of sensation there.
Yeah, they told me it was because it was rooted so deeply that they had to cut very deep.
I see. Okay. So you can feel me touching you here, correct?
Yes.
Okay. Okay. All right. I'm going to test something here briefly. You're having some issues with sensation. I just want to see how severe that is and see if it's connected to the spine at all, just as a precaution. So you said you can feel pressure, so you feel me touching you here. Mm-hmm. And does it feel different on this side?
Yes.
It does. Okay. Can you feel this sensation here?
Yes.
Can you feel that here?
Yes.
Here?
Much lighter, but yes.
Much lighter, but you can feel it.
Mm-hmm.
All right. Something much more significant. Can you feel here? This is pretty sharp.
Yes.
You feel sharp here?
Yes.
Do you feel sharp here?
No.
But do you feel anything?
No.
You don't feel anything there.
Oh, that there, right there. I felt that.
You feel it here?
That one. It's like very specific points of it that still have some nerve.
Okay.
So
if we do vertical instead, you feel here?
Very, very lightly. I have to pay attention.
Okay. This is going to be really cold. It should be at least. You feel cold here?
Mm-hmm.
And here?
Mm-hmm.
And here?
Slightly, yes.
Slightly. So when I touch you here and here, can you tell that those are different?
Yes.
And if I do that here and here, do they feel different?
Yes.
They do. Okay. So you can still tell the temperature variation.
Mm-hmm.
All right. And if I come along the spine, any difference in sensation here?
No.
And with the sharp as well?
No.
Okay. Can you tell the difference between this one and this one?
Yes.
You can. Okay. All right. So that's good. So you do have some very mild nerve damage, but you can still feel. It's not like you're completely lacking in sensation there, which is good. Specifically along the spinal column is my biggest concern. So I do see some abnormality in the scar tissue here where you said there was some, friction of the clothing. But otherwise, I would say it has healed fairly nicely. And coming down the lower extremities, I do see one kind of larger mole here. Now it is flat, not raised above the surface of the skin at all. And very normal, non-concerning in color. Kind of a light neutral brown there, no spotting, which is good. A couple of those same red marks. Also looking at the veinage, I do see some, got quite thin skin. I can see your veins protruding here at the back of the knee. Right, and again, having a look at the tattoo. Another mole here. You've also got, this looks like your shoes rub quite a bit on the back of your ankles.
Yeah, I wore a pair of heels and then threw them away the next day.
Okay. They did scar your ankles, unfortunately. So just noticing that discoloration there. Alright. Also just going to feel around for any physical deformities, any lumping or abnormal bumps or anything concerning underneath the skin. I like to palpate more the back of the body because it's not, generally something that you're able to feel yourself or that you're performing as frequently as you would be the front. Any pain or tenderness anywhere?
No.
Alright. Okay, and this tattoo as well looks it's healed fairly well. Just gonna have a look. Stretching of the skin allows me to see if there's anything concerning there, but it's not notable. Okay. All right. All right, Ariel. Overall, I would say that there's nothing, overtly concerning for your first appointment, and just kind of a brief overview of any, catch-ups that we needed to do based on your relocation to the office. I don't see anything on your body really that I would say is concerning. Now, I would like to do a more in-depth scalp inspection, which is what we've already discussed. I do think it's a good idea to have a look at your scalp when I'll have a little bit more time to kind of dedicate to that area specifically. If you're comfortable with it, when we do your scalp examination, I can work in, a 20-minute more private inspection and kind of having a look at your breasts as well as the axillary area, having a look at your, your pelvic region and seeing if there's any abnormalities that you're not seeing there. We do, like to have a look at the buttock and everything and see if there's any, especially someone who's prone to, moles and discoloration. So on first appointments, we don't generally go that in depth, but since we're, having you come in for a secondary scalp inspection, that is something that I recommend. Obviously it's, well within your rights to decline, but I do like to offer specifically with someone who's had a history of, cancerous melanoma. It might be something that you want to consider just for, the betterment of your health and prevention there. So.
Oh, definitely. That's something that I'm definitely interested in because I just want to make sure you can never be too careful, especially with melanoma.
Yeah,
so.
for sure. Especially, a lot of people think, well, the areas are not exposed to the skin as much, so it's not as big of a risk, which, can be true, but also they can be, you know, more nefarious in that you're not really looking in those areas. So it could be something that you're missing, which I do notice. So, you know, not with you specifically, but with my patients. So I will go ahead and get you scheduled for that scalp inspection, and I'll give myself a little bit of extra time so that we can also complete that secondary examination. And if it's all right with you, I will have all of that information sent over to your patient portal, and then we can get you scheduled that way.
Okay, perfect.
All right. Okay, well, I'm going to head off to my next appointment, and I hope you get home safely.